Our first speaker is a phenomenal woman. Her name is Dr. Aderonke Bamgbose Pederson. Dr. Pederson is a psychiatrist and faculty member of the Feinberg School of Medicine at Northwestern University. Dr. Pederson's work focuses on advocating for the mental health and wellness of Black people. Dr. Pederson's research focuses on building interventions to reduce stigma around mental health in the Black community. And there is stigma, folks, in the Black community about mental health. She is particularly interested in the intersection of race, religion, stigma, and migration. And she's funded by the National Institute of Health, maintains a clinic that serves particularly Black women. She's an author and she's published peer-reviewed articles as well as a seminal book with the Oxford University Press. She has been featured on NPR, The Washington Post, and the Chicago Tribune for her work in highlighting and advocating for health and wellness in the Black community, particularly Black women. That is why she is here today, ladies and gentlemen. Dr. Aderonke Bamgbose Pederson, take it away.
Hi, everyone. It is such a pleasure to be here in this space, to share this space with you. As I was introduced, my name is Aderonke Pederson. I'm a physician, I'm a psychiatrist at Northwestern University, and I just cannot say how much of a pleasure and how grateful I am to be here in this space, to share this space with my sisters. And, you know, I almost want to do a mic drop for Micah's introduction in terms of just introducing this entire event, just in terms of talking about things like stigma and how important it is for us to talk about these things, for us to see people who we highly respect and regard talk about these things. And I want to start with talking about stigma as Micah's introduced that word and that topic, because stigma is something that, you know, I study, and stigma is something that is very prominent within the Black community. I think it's prominent across the board, but I want to specifically talk about stigma as it relates to us in the Black community. Some of my areas of research, like Micah introduced me, include, you know, talking about stigma related to mental health, stigma in the Black community, but also stigma related to race, religion, and migration, meaning I work with African immigrants as well. So what is stigma? We use that word quite a bit. What does it mean? Essentially, stigma is having negative attitudes and beliefs about mental illness. And I like, you know, I think it's important for us to parse out then, you know, how does that sort of play out? So stigma can be towards ourselves. So we might have feelings, you know, negative feelings and beliefs about ourselves because we have depression or anxiety. Stigma can also be things that we feel about what other people think of us, and that's sort of sometimes called like public stigma. And stigma can be how we feel about other people, and I think that's something that, you know, we do need to talk about and do need to really allow ourselves to explore this idea of how do you relate to other people who might share with you the struggles that they might be having, who might share with you that they're depressed, or they saw a therapist, or they saw a psychiatrist. What are some of the ways in which we respond that make it hard as a community for us to talk about these things? And so when we're talking about stigma, I think it's really important for us to think and reflect. You know, how do I contribute to stigma and how do I experience stigma? And really trying to look at it from both sides. The other thing I really think it's important for us to talk about is, you know, this idea of sharing our own lived experiences with others. Because I think many times we, you know, have our sort of secret ways in which we deal with our mental health, but we don't talk about it publicly. So one of the things we found in research is that one way to reduce stigma is to actually share about our experiences of stigma, to share about our experiences of mental illness. So for example, I'll share some of my experiences when it comes to mental illness and mental health in general. You know, I lost both of my parents by the time I was 17 years old. I was an orphan by the time I was 17 years old. So I went to college without a support system, without a support network. And in part that was exacerbated by by my status at that time as an international student. So I didn't fall within any particular brackets within the system. And my process of getting through that time involved just this idea that, you know what, I'm a strong Black woman. And I think we hear that a lot. You're a strong Black woman, you can get through it, you just, survive. And I think many of us kind of live in that space of we just need to survive another day. But really what I want us to talk about is the importance of thriving, not just surviving. And what does thriving look like? Can we thrive by ignoring our mental health? Can we thrive by just focusing on our physical health? And I'll talk about how I think those things are one in the same, that they're not really two separate things, but they're really one thing. And that idea of being a strong woman, a strong Black woman, I think it's really important that we understand that strength is not just about what you can do, but strength is also about appreciating our limitations, appreciating our weaknesses, appreciating those things, that might set us back if we ignore them. So part of being strong is actually acknowledging that we're human and that we're weak, and that it's okay to admit that we're overwhelmed, that we're stressed out, that we're having trouble sleeping, that we're anxious. It's okay for us to admit those things. And in many ways, that is part of strength. It's very difficult. It's very hard to ask for help. It's very hard to ask for support. But part of our strength is being able to identify those things that we're struggling with and to identify the places and spaces in which we can get help. And that brings me to the next thing I want to make sure we talk about, which is a toolbox. I love that we're doing a raffle to give away what we're calling like a stress, package, a stress gift bag. And so I want to use that to talk about what we call a toolbox, a coping toolbox, that we can use to kind of get through things. And I think for a lot of people, there's this feeling that your toolbox can only be one thing, or your toolbox, which is how you deal with stress or anxiety or depression, can only be, for example, my faith or my religion. So when I look at stigma and when I work with folks in the community about stigma, one thing that always comes up is this idea that I have to pick and choose. I have to pick my pastor or my priest or my imam. I have to pick that, or I go to the doctor. And I think it's really important for us to understand that that toolbox can include both things. So it's not about throwing out one or the other. It's okay. I think it's so important, that we embrace those things that are helpful to us. So whether that's religion or faith or spirituality, that can be in our toolbox. But I also think it's important that we don't ignore those other spaces like seeing a therapist, seeing a counselor, spaces like getting medication. And these are taboo topics sometimes, but I'm so glad that we're having these conversations. So in your toolbox, you could have your spiritual leader in your toolbox, but you could also have your physician, your psychiatrist, your therapist in your toolbox. And the goal is that as you go along, that you're learning more and more and more about yourself, to the point where you fortify that toolbox in such a way that it fortifies you. I'm really grateful for those women who've come out, Black women like Michelle Obama, to talk about mental health. I'm also grateful that I've seen a couple talks by Kamala Harris about mental health. And one of the things she said a couple times now, which I'm so excited about, is that, our health is not just from our neck down. Our health is also from our neck up. And so she's talking about mental health, and she's talked explicitly about mental health. And I think that's so important, especially because of some of the things Micah brought up earlier. The fact that, as a community, as Black women, we take on so many burdens, and we're asked to sort of, kind of pretend and go along as if these burdens are not being absorbed into our bodies in a way that then put us at risk. Not just for depression and anxiety, but remember that these things also put us at risk for other physical illnesses like cardiac issues, like diabetes, that our body is a holistic thing. And it's important for us to think about our bodies holistically, that our mental health affects our physical health affects our mental health, and that they're in many ways one and the same. It's sort of like a construct, in our world today, that we talk about them differently. Another big body organization that has talked about mental health is the World Health Organization. One of the things the World Health Organization came out and said, many years ago, is that there is no health without mental health. And when we're talking about things like depression and anxiety, what are the symptoms of depression? Sometimes we might notice our sleep changes. Sometimes we might notice our appetite changes, our motivation to do things changes, our relationships change. We're not as excited about being around people. We feel more lonely even though there are a lot of people around us. And it's really important for us not to shy away from the idea of getting help in those times. Because one of the things we see in the Black community, whether it's African Americans or African immigrants, is that we delay seeking treatment, and how important it is for us to get support and help early on, because the more we delay it, the harder it is to sort of get back on track. So the main thing I want to leave everyone with today is the importance, the vital importance of taking care of our mental health, understanding what's in our toolbox. And our toolbox, like I said, can be a combination of things that are unique to us, the things that energize us, the things that rejuvenate us. And, from the psychiatrist, the therapist, like we talked about, to the religious leader, to the priest, the pastor, like we talked about, but even journaling, even exercising, all of these things are part of our toolbox. And we don't want stigma of mental health to become a barrier to us thriving. Because at the end of the day, the point of mental health care is that we don't just survive, the struggles and the stresses that we're experiencing constantly, but that we thrive, that despite all of these things that are going on in our society, that we find a way to really guard our mind and allow ourselves to really thrive. So thank you so much for having me. Thank you so much for having us talk to you today about mental health. It's been a pleasure, and I really appreciate this time.
Dr. Pederson, thank you so very much. That was phenomenal. I loved how she brought up the fact that stress and things can lead to so many physical illnesses, and we need to be aware of that. Also the stigma, and to have a toolbox. I hope that we take away a lot of things from today's event and know that mental health should not be a taboo topic.